Welcome to the Susan Brender Show. It's all about you, featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. I'm just honored to have my guest. Her name is Dr. J. Gabriella Juris. She's a medical geneticist and an award-winning health and nutritional scientist. More than 2 decades ago, she pioneered an innovative lifestyle intervention program for prevention and treatment of chronic lifestyle-related diseases such as metabolic syndrome, obesity, type 2 diabetes, heart disease, high blood pressure, digestive disorders, and cancer. Now, what a mouthful. I mean, wow, Dr. Gabriella, welcome to the Susan Brender Show. And boy, have you been involved in many things.
Thank you so much. You're very kind. Yes, it has been practically 30 years ago when I opened my first center in 1988 in Newport Beach, California. And I had big dreams and big idea that you can really change everyone's health by changing, modifying their lifestyle, but not just the way we live. It's the way we think, the way we eat, our spiritual base, and our environment. It is all inclusive, and it has to be working in unity. One doesn't work without the other. It's not complete.
Now, hold on a minute. Let's just talk a little bit about your lifestyle intervention program, because not everybody understands exactly what it does. So tell our audience a little bit about the lifestyle intervention program.
I created a program that I call Lifestyle Intervention in 1982 because of my personal experience that happened to me when I got ill in 1985. And out of blue, I got ill, and without going into details, I have had surgery on my lung. I have recovered. And there was nothing after that. No one helped me to get back again and get strong. And in my background, I've been world-renowned athlete, and I knew nutrition, and I knew how to prepare for a race. But for some reason, I still got ill, and I didn't understand what was missing in my program. And that's where I started to think about all aspects of lifestyle must be changed. All 4 aspects, your physical aspect, your mental aspect, the way you think, you have purpose in life, and your environment. So in 1988, I decided to open Lifestyle Health Clinic, and that was for people who had risk factors that lead to the development of life-threatening diseases, so-called old age. And, of course, the risk factors are the obesity, high blood pressure, and high cholesterol, and high stress levels. So I look at these risk factors, and I put together the program that have been very effective, very successful. I had lots of people who have actually reversed their heart disease. They reversed their diabetes type 2. And I became sort of a teacher to others, even lectured in colleges. And for my work, I received the American Heart Association, which I am very proud of, and that made me feel like I am on the right track. And in 1992, Dr. Dean Ornish have created a lifestyle intervention trial. And when I found out, I felt really good, because at that point, he proved that, yes, you can reverse risk factors such as obesity and metabolic syndrome and diabetes by changing lifestyle. And when I read it, I thought, I am the pioneer in lifestyle modification, because I started before the research was published in Lancet in 1992. And from there on, my life just was dedicated to provide programs lifestyle intervention programs, because that's the only way how you can reverse and treat chronic illnesses.
All
So
right, let's go
that is my history.
It's a fabulous history. So much of your work has been given attention by the American Heart Association and various other organizations, and you started on a very, very good platform. Now, hold on a minute, because I want to know something. You know, there are countries like Japan. I'll give you an example. In Japan, the people don't deal with any kind of obesity issues, nor are they I don't know about the diabetes, but I doubt it that is part of the problem. Now, how is it that kind of country, the people in that country are able to have great diets, stay thin, have low blood pressure, and all kinds of digestive disorders do not seem to exist? So what is it that they're doing that makes them healthier than we are?
And very good point. And it is very noticeable that the Japanese people are not as obese as our American people. And it's noticeable that they do not have as a high percentage of heart disease, for example, as we have. And it's interesting that many cultures, like the Japanese, have been smoking, for example, a lot. And the disease that is really so I would say important in Japan and other countries like China even, is cancer, lung cancer, because in their lifestyle they may be eating other foods and better foods to prevent heart disease. However, lung cancer now is the predominant disease, and that just to show you that it is the lifestyle. And now with changing of the Japanese diet by bringing in the fast food, and we know that that is what's happening around the world, now we have increase of obesity, diabetes, and heart disease, just like in the United States. So that proves that it is definitely important element that we have changed our diet from being healthy, from not having heart disease and cancer in our history. And now when we change our diet to modified food, genetically modified food, processed food, purified food, and that foods, artificial food, packaged food, and all that, now we have such a big increase in heart disease. And, you know, in the last 30 years, actually, nothing improved, nothing changed. And now we are getting into the point that we have a obesity epidemic in children.
Yeah. All right, let's talk a little bit about obesity. If you had your choice and you could go to a school like a college or a high school or any place like that, how would you put together a program that would get the kids to reduce the amount of processed food they ate? And would they be able to take the message from you and bring it to their families, because it's their families who are giving them everything that's wrong? So what would you do about that?
Very good question. Children really dictate what is going to be for dinner. Children dictate what they are going to eat for breakfast. But children are looking at the advertisements, and they are seeing all these delicious foods, and they will ask mom and dad to please buy it. They are looking at the snacks, the constant promotion of the snacks, multiple snacks, and they will say, please buy these snacks, and they bring it to school. Children are our future, and we need to teach them what is good for them and what is not, and also explain that if their parents will eat such a way that they will get heart disease or they will get diabetes, they will understand the life of their parents will be shorter. And they will tell their parents to please not buy certain things, but buy other things. And that is so important. Children are our future. So that brings me to Children Obesity Foundation. I am totally dedicated to this cause, and I am with the Children Obesity Foundation preparing programs that we can implement around the country at schools and for families, because the only way how we can make a change at schools and for children is by education.
Let's talk a little bit about the Obesity Foundation, because it's something that you're part of, and you have a lot of passion to bring different programs through that organization to kids and to adults and to all kinds of people. So what is the Obesity Foundation, and what does it do?
The Children Obesity Foundation is a non-profit organization, and we have been dedicated to fighting obesity epidemic because we know that the statistics shows that our children are overweight and obese, and if this is the case, they are already going to have a diabetes or type 2 diabetes at much younger age than their parents. And that is a big danger because it will shorten their lives. They will be dependent on medications such as insulin, and that leads to damages of their eyesight, of their heart muscle, and even peripheral artery disease and amputation. These children are obese from very young age. They are 4, 5, 6, 7, 8 years old. And when we look at the statistics and look at what's going on, then we look at the families and we say we have to work together with families and children and provide the programs that are accessible in each community. And this is going to be very rewarding. I created all the programs, wrote the manuals that would be taught to program facilitators. And these facilitators would meet with the families with children in a group sessions, let's say 2 months each. And we would be able to teach the kids with the parents together that actually they have options, they can eat delicious food, and they can be not only losing weight, but also feel more energetic and be healthy. Children Obesity Foundation came to my life just out of blue. I was referred to the chairman, Amos Snow, and he called me, and I immediately decided this is it. This is where my life achievement can be implemented. And we have done some of the work, successful work, in Buffalo, New York. I have done this over years and implemented program to my patients. And we are hoping that we get the support of public in such a way that we can really implement the program across the country and help to fight the obesity epidemic.
It's all about the books that you've written that I'm curious about. For example, you've had 3 very successful books now. One of them is called The Transform Fit to Fit. Tell us a little bit about what's in that book.
Transform Fat to Fit. It was written after my first book, which was called Conquer Fat for Life, that I have written in 1994. And that was used even at the university here in private Chapman University when I taught 3 courses. And I have improved the program and ultimately wrote Transform Fat to Fit, that explain in a layman's terms, but a very precisely and precise medical science for people to read it and realize they can make minor changes and they are going to lose their fat and they are going to build their muscles and they are going to be healthy. Now, I am calling this metabolic weight loss because you have to balance your metabolism in order to burn fat. It's people go to the gym every day and they are still not losing weight. And that's because their hormonal metabolism that controls weight gain and weight burning is out of balance. And that is what my book explains.
Mm-hmm. Now, there are 10 principles to becoming a master of your health. Can you give us a few of those principles that you're talking about in this book?
Yes, yes. I have been writing actually my other book, and it's not completed. And for lack of time, I have not finished it yet. But it is going to be awesome, and hopefully also videotape. I have condensed the principles of extraordinary health to 10 different areas. And I write about all 10 different areas, and I call it the 10 principles. But basically, why I am writing this book is that we know now with the new upcoming research of epigenetic that actually you can change some of the gene expression that you inherited from your parents. So actually your DNA does not dictate your health destiny. You can change it by changing your lifestyle. And now this is what I believed 30 years ago, and now we have a proof that actually you can change your genes. And by changing the way you eat, the way you exercise, the way you think, and the way you feel, and you can actually change what they call the predisposition, let's say, to obesity or predisposition to cancer, heart disease. You can actually change it. And so my last book will be talking about that your DNA is not your health destiny, that you can change your gene expression, you become the master of your health.
That's amazing. I always believed, and I was told by several doctors, that if you have a certain disease that your parents had, that it was just a genetic predisposition to a different kinds of problem that you're going to get. So what you're saying is that's not true.
No, it is not true. I actually knew that early on instinctively that the lifestyle choices we make today will greatly alter how our genes express themselves tomorrow. And that's why I opened this lifestyle health clinic. But today we have the proof, because of epigenetic, the new science that is now very important science. And that makes me even more excited of being part of Children Obesity Foundation, because now we have truly scientific base for our work, and it is not just an interesting work. That's what I used to be called 30 years ago. Dr. Juris, you are such an interesting person. No, today it's a fact. Today is a reality. And actually we today are preparing for a film that will be extremely important film about a little boy who was obese at the age of 12, and he changed his family by changing the lifestyle. And so we are right now in a process of getting money for the film, and hopefully next year it will be already out there for all the parents and children to see. Exciting time. We live in a very exciting time.
Sure sounds it. Now, this is a very interesting organization that you're talking about, and I'd love to know the mission. Tell me about the Obesity Foundation's mission.
Well, I've been involved very much in creating the mission for the foundation. And without making it long, I just want to point out that we are dedicated to changing the landscape of our nation collective health. We must make changes, and we must stop the American #1 epidemic and killer, which is obesity. We need research. I have spent a great deal of time presenting research proposal to I would say, a board of peers. And I have presented the research, which was basically about my study, that we would study the impact of lifestyle intervention program on overweight and obese children. I have received a clearance for the proposal and became actually the research investigator. And as a principal research investigator, the only thing we need is get grant or get donations, and we can start to do these programs and collect the data. Because we do need data, we need to have numbers, we need to see how many children and how many families have dropped their percentage of body weight and how many children are now healthier. We need to work with pediatricians, with pediatric clinics. But we have to have numbers, and because I became a principal research investigator, and we have the program ready to go, we are trying to do different programs in communities to raise the capital, and then we can start and show population at large that you can do it.
What about the government? How are they involved? For example, the NIH, which does a lot of research, and people love to go to the NIH for monies to sponsor or to support a grant. Have you ever thought about that? Have you ever gone to the NIH? And if you did, what kind of answer did they give you?
Actually, the proposal that I made was my research protocol that I presented to Institutional Review Board, IRB, and that particular protocol was for the study of lifestyle intervention by National Institute of Health, and they had maybe $2 to $5 million to provide 2 to 3 years study of the families with overweight and obese children. That was the reason why I actually wrote the protocol, and I was approved and cleared to do the research on human subjects. However, all of this is available to people who are set with the staff, permanent staff, of grant writers. And these grant writers are extremely savvy and able to answer these many multiple pages of application. These are federal grants, and people like you and me just cannot do that. It takes a skill and knowledge. We do not have grant writers in our nonprofit organization, but from the money that we are going to get because of donations, we will hire then a grant writer who can keep writing and applying for small grants and large grants like the National Institute of Health research grant.
One is also interested in knowing a little bit about what kind of cooperation that you're getting from different organizations, because it sounds like you have an amazing program, and there should be somebody who is a supportive group that can help you. So have you received or have you been in touch with different organizations to see whether you can do something together?
Yes, there are a number of organizations that are excited about working together in the future. And I think that we are in a process of making it happen. Particularly the entertainment industry is extremely interested in working with us. And one of the things that we are doing is preparing for the film about the little boy. And we have already a producer, and we are just trying to get a director and the funds necessary to do this film. That will be huge, and things are going to change right away. We have been approached also by another producer to provide documentary. Those are wonderful things that put us on the map. But, this is not a program that could be run by a few people. This program truly needs the funding so we can hire the experts that will help us to put us on the map and provide different fundraisers. So at this point, we are really, really asking the public if there is someone who wants to be part of this movement, I would love to talk to them, and I would love them to join us, because I think it will be team effort. And they say it takes a village to raise a child. Well, it probably will take a village to get Children Obesity Foundation on the map, and everybody will know about our work and our research.
One of the things that I'm also curious about is why in medical schools, for example, even in schools or hospitals where there are interns and residents, how come they're not teaching them all about good nutrition? It doesn't seem like that they really know a lot about that, but you do. Now, wouldn't that be an interesting thing if you can offer medical schools your programs?
Well, this would be my hope and my dream, of course. This is pretty much very political, who is funding American Medical Association? Who are the people? What is the interest? What's the financial interest of Big Pharma? This is not happening because there's a money involvement. This is not about the cause. This is about money. And our doctors are not taught the principles and the fundamentals of the functioning of the body. In order to treat disease, you have to really understand the physiology and pathophysiology of the body. And there is not as much emphasis on that, but we have lots of emphasis on what to prescribe for certain complaints or symptoms. There is a saying that if you learn how to use a hammer, then everything will look like a nail. And this is exactly what's happening in medical schools. They are learning how to use the hammer, how to get a prescription for any symptoms you may have. So you have a headache, you get a painkiller for headache. But that's the nail, that's your prescription. But what about looking what causes the headache? What causes the indigestion? What causes the obesity? What causes diabetes? What really it is? So we don't have to use these nails for treatment, but we actually remove the cause.
You feel pretty positive about the future of your program and the way that people are learning and the way people are going to accept and do things about their body. Am I right about that? Because it sounds like you have a great attitude and you want to tell everybody that it is important to really support you in your efforts.
I am very, very positive and encouraged. First of all, I truly helped thousands of people over my 30 years of experience in practice, in private practice, and also when I was a professor, adjunct faculty at Chapman. I have got extremely positive acceptance. I really feel that people now understand that they have to be in control of their health because of the changing medical care, changing insurance policies. People are realizing that really they have to make decisions. They have to get education. Unfortunately, sometimes they get wrong education from the media. And people get confused about low-fat, no-fat diets, no-sugar diets. All of that is very confusing and also incorrect. And I think that that's where we come in and we kind of teach the basis of health, the fundamentals of health, make it simple and go back to the nature, what the nature gave us, what nature intended for us.
Dr. Juris, everything that you've been talking about today has a lot of relevance and a lot of good information, needless to say. Now, I want you to tell our audience all the things that are necessary for you, such as you mentioned the Obesity Foundation. What do you want them to do, and what do you want them to know about that?
Well, Children Obesity Foundation really needs your donations. If it is $1 or 50 cents or $5 or more, we must get donations so we can start implementing these programs. That is so important. Now, I am offering also personal consultations for people who need my help in prevention of diseases, or if they have symptoms and risk factors that lead to a disease, or even if they already have a disease. And for the consultations, naturally, they would pay Children Obesity Foundation, and we would raise money as well this way. So I'm offering my consultations, if it is 15 minutes, half an hour, or 1 hour. And so, of course, donations are so important. And who wants to join us to be a working partner? We would love that. We need grant writers at this point very much. And that
so
would be.
If they want to help you out, how do they get in touch with you?
You can, of course, email to Dr. Juris at childrenobesityfoundation.org. So you can email Dr. DRJURIS at childrenobesityfoundation.org.
And if they want to get the books, what about your books? How do they get that or those?
Oh, that is really easy. Right now it is on Kindle, and I believe it's $9.99 on Kindle. And you can get it, of course, anytime. If you would like to have a hard copy, we can ship for you a hard copy. And again, portion of the money will go to Children Obesity Foundation. So you can just email us, and we would ship to you the hard copy.
Now, Dr. Juris, I want everybody to know that the Susan Brender Show is going to have an Ask Dr. Juris little piece at the end of the show, so that she will be able to talk all about various things that are concerning wonderful, absolutely amazing stories about health, and what she will give you is a little information and education that will be so important for everyone. So just stay tuned, and you will hear Dr. Gabriella Juris on the Susan Brender Show. It's been a pleasure, Dr. Gabriella, and I look forward to having you on my show so that you can give everybody the information they need. Thank you very much.
Thank you for having me. I appreciate it.
Thank you for listening to The Susan Brender Show. To be a guest, email sebrender@yahoo.com.